Hello viewers, I welcome you to PDO channel, Padre Dr. Koromi channel. I want to thank all of you who have taken out time to subscribe to this YouTube channel and who keep following me to know what is updated on this channel. So today I want us to look at the woman person. You know, from my own experience so far in herbal medicine, I have come to discover that women have more health-related issues than men, especially reproductive issues than men. I can count like 10 health issues, reproductive health issues that women pass through. But as you're counting 10 for women, you may be counting, say, like 1 or 2 or 3 for men. So if it is not issues of ovarian cyst, it will be issue of PCOS. If it is not PCOS, it will be PID. If it is not PID, it will be fibroid. If it is not fibroid, it will be infection. If it is not infection, it will be hormonal imbalance. If it is not hormonal imbalance, it will be fallopian blockage. If women have more reproductive health issues than men, and from research, it is discovered that it is because of the shortness of the shortness of the urethra. That's what really makes this the way it is, because the woman can easily detect infection faster than the man. So and also too, issues of infertility is also there. You know, women have more issues to battle, issues of infertility to battle. But it's not as if most of the infertility issues, women are really the one that are really involved. As I'm talking about that one too, we also have issues of menstrual disorder. You know, if it is not, you also have discharge, irregular discharge, and all these things. So there are a whole lot. So what I want to do in this video this morning is to help that woman out there who is still contemplating or is thinking, what am I going to do about this particular health issues? What am I going to, which kind of tests am I going to do? And because sometimes the major problems we have is because we don't even know what to do when we are having certain health issues. But I'm going to help us out so that we can be on a stable side when it comes to knowing the kind of test to carry out. For instance, if you want to know whether you have a PID, a UTI, fibroid, or you're having cyst, you know, what you do is to go for a pelvic scan test. A pelvic scan test, we review PID, we review UTI, we review fibroid, we bring out PCOS. PCOS is multiple ovarian cysts. So that's the thing. So and HVS, another test that is also important is HVS. And how do they do this HVS? They collect the discharge from the woman, and this is able to tell infections such as staphylococcus, yeast infection, E. coli, chlamydia, and so on and so forth. And there is another one that is also called hormonal profile. So what does hormonal profile, what does it do for the woman? Like what does it review in the woman? Hormonal profile test, what does it do for the woman? It tells you if you have hormonal imbalances, because many women out there too who are having issues of conception, hormonal imbalances is also another problem they're having, and they don't really know that they're having hormonal imbalances. Every act of infertility is not only caused by the woman, because the problem that we have in this part of the world, especially Nigeria, the woman is left alone to be running up and down to sort out issues of infertility in the marriage. It's very wrong. In my practice so far in phytomedicine, I noticed that women are the ones who are always carrying the issue of infertility on their head. The men will just be there. They will say, oh, nothing is happening to me. That's not truth. That's not truth. Men also contribute to the issue of infertility in the marriage. So let it not be, men should not always be forming giants that, oh, I don't have issues. It's the woman that have issues. No, that's a very big lie. Infertility issues should be 50% contribution. As the man is looking for solution, the woman too should be looking for solution. And that is why whenever patients come to me for issues of infertility, I tell the woman, because majority of those people that comes are women, I tell them, I can't treat you in isolation without your husband. Your husband too has to come, because the problem may not be you, the woman. The problem may be the man. So, hormonal profile test, it will review hormonal imbalances, PCOS, high prolactin, and so forth, and etc. This test is usually carried out some days after your period, but before your ovulation time. Understand? So that's how it is being done. Now, the last one I'm going to discuss this morning is HSG. They call it, my learned colleague that's called ACE-HAP. We call it is the most expensive and painful one, because this is the one that basically reviews infertility. Yes, because it reviews block fallopian tube, and it also tells if you are fertile or not. That's for the woman, and if your eggs are really working. Many clients that have come, they've complained that this is very painful. Yes, it's really painful because of the process that is involved. Now, look at all these tests. Now, what does it really cost? Because sometimes ignorance is usually our problem, and sometimes we feel that, oh, we can cut corners, we don't really need some of these tests, we don't need to do these tests. Ignorance is usually a big problem. Okay, for instance, now the pelvic scan test, what does it cost? It only costs 1,500 naira, 1,500 naira to do. Now the HVS, what does it what does it cost? It costs between 3,500 to 4K to run this test. And the hormonal profile test, it costs between 18,000 to 30,000 naira, depending on the location that you are. And the last one, which is HSG, what does it cost? It costs between 40,000 to 60,000. That is the range. It also depends on the location too. Now, my people out there, especially the female folks, you need to carry out this test. It's very important, because you don't treat in isolation. Like I keep telling most of my patients, I don't treat in isolation. If we are using herbs, we use herbs based on what your scan result has shown us. Then we treat you from there. So we do it hand in hand. So what am I simply saying? Go do one of these tests, or if possibly do all of them. If you have not been able to conceive, try and go and do one of these tests and see what the problem really is. Then when we know what the problem really is, then we can start up the process of your treatment. Remember, we are healing through herbs. And who has given us the herbs? God is the one who has given us the herbs. He has blessed the herbs, that the herbs should be source of healing for us. So what we do is to use the herbs that He has blessed, to use it for healing for us. So I pray that God will continuously grant us good health of mind and body, grant healing to those who need healing. Thank you very much. And if you have enjoyed this broadcast, do not forget to subscribe to this YouTube channel, PDO channel, Padre Dr. Kuromi channel. So thank you very much. God bless you.